9 out of 10 patients that are watching this video will have a low back injury at some point in time in their life. The low back is crucial. You have a lot of weight and a lot of focal points in the low back. It's very important to take care of your low back. And if you're in pain, the last thing you want to do is do an exercise or a stretch improperly. And we're going to show you a couple stretches that are done improperly on a regular basis. The first one is touching the toes. Many people will touch their toes and bend down, and where this goes wrong is you're reversing the curve in your low back, putting too much strain on that focal point in the lumbar disc, and that's where 90% of us have the problem. When you come up. So you can do this stretch properly if you keep your back straight. But so many people don't do it properly, I don't even recommend it. But if you keep your lower back straight and stick the rear end out and not tuck the hips, you'll still get a stretch in the hamstrings in the back of the legs here, and yet you will not have the strain as much on the low back, more into the hips and the buttocks. But I recommend not even doing that. That's a stretch I don't even do. The hurdler stretch is another stretch that is done improperly so often that I recommend people avoid it altogether if they can. But you really do need to get a good quad or hamstring stretch, and we'll show you in a moment how to do it properly. But whether you have your foot in front or your foot behind you, this stretch can be done improperly very quickly. Most people will lean forward, and the minute that they bow their low back and reverse the curve in this lumbar spine, that is when we have the biggest problem, because now we're not only stretching the hamstring, but we're also stretching the low back, and we could be injuring an already irritated disc down there. A proper way to do this stretch, if you are going to do this stretch, is put your chest out. Make sure that you lower your chest towards your elbow, and you can see that Alyssa's getting a really good pull right here in her hamstring without having to go so far as to touch her toes. Trying to reach that extra few inches to get that gratification isn't worth it. 26 years ago, I herniated my low back disc, so I know what it's like to be in pain, and I know what it's like I know the best way to avoid it. And this is one of my favorite exercises in terms of loosening up the hamstrings here and not endangering the low back. So to do this exercise properly, or stretch properly, you want to keep your head up, your shoulders straight, your back straight, and then you just want to lower your leg. Now this does require some strength on your opposite quad, so you're actually getting a good workout on this leg here while you're stretching this one. Isn't that nice? 2 in 1 again. You want to hold this stretch for 15 seconds, and then another 15 seconds. It's quite a workout for your opposite thigh, and Alyssa can attest to that. This stretch gives you a stretch all the way into your calf, up to the hamstring, and into the buttock. It helps with the pelvis, and it gets a great stretch up and down. If you're having trouble with your balance, you can move up closer, hold on to the chair, hold on to the wall next to you, and you want to lower that buttock down as far as you can. You can have the knee bent. I don't recommend that you hyperextend the knee. It doesn't have to be straight. You can still feel the stretch all the way through. And that's what our point is. And whenever you're stretching, it's better to isolate 1 or 2 muscle groups rather than try and do several at the same time. The quadriceps are the largest muscles in your leg. They're very important for maintaining balance and in the buttocks and in the low back. They're supportive muscles and the largest leg muscles. They're very important to stretch. What we're doing is the quad stretch, and if you can lift up on the ankle, again, you want to hold this stretch nice and slow and easy. Go to your maximum. to 15 seconds. And then after 15 seconds, you should be able to get that extra little stretch, another 1 to 2 degrees. Now, if you're not able to reach your ankle, you can use a belt, you can use a rope, you can use a towel, and wrap it around your ankle and help that stretch. By the way, if you are not able to reach your ankle, you really need to make that one of your goals. I don't care if you're 60 years old or 80 years old, we need to make sure that these are strengthened and that they're stretched well. The knee to the chest stretch is crucial for the pelvis and the buttocks and the low back stability. You want to bring up your knee, support it with both hands, and pull towards the chest gently and smoothly, no jerky motions. Keep the opposite leg down and feel the stretch in through the buttocks and even the upper part of the hamstring. This is great for our pelvic subluxations or sacroiliac joint problems also. You want to switch and you want to do both sides. Again, hold for 15 seconds and then get that last bit after 15 seconds, get another 1 to 2 degrees. Great. That's a great stretch. You should feel a nice pull and no pain. If you feel pain, you want to make sure you stop it and let us know that you have the problem. To get a great gluteal stretch or buttock stretch, the knee to the opposite shoulder stretch was where you're going to feel the most stretch. You want to pull up and to an angle about 45 degrees toward your opposite shoulder. Hold for 15 seconds after you've gotten to that maximum part of the stretch gently, and hold it there. After 15 seconds, then you want to get that extra little pull. Try to keep your hip on the floor as much as possible and your shoulders on the floor. And you want to minimize spinal rotation and maximize hip stretching in through here. You should feel it also into the side of the hamstring there. A low back care plan is never complete without abdominal strengthening. Your abdominal muscles support the low back, and when you have a severe imbalance, when the abdominal muscles get weak, maybe after a C-section for women, or just that lazy belly, you can develop low back problems. So we want to do a very safe, very effective way of strengthening the abdominal muscles, and this is the abdominal crunch. Now, to do this, you want to cross the arms in front. You want to slowly come up. Keep the bottom part of your shoulder blade on the floor. You want to press the low part of your back into the floor and then tighten those abdominal muscles. You want to suck in the abdominal muscles. If you're pushing out too much, you can develop a wall of muscle that's sticking out, and that's never what people are looking for. So you want to suck that stomach in before you come up, and then bring it up and hold. And you want to hold for anywhere from 5 to 10 seconds per time, and you want to do at least 10 of these. A couple other things to think about. You want to make sure that your ears are again in a neutral position with your shoulders. You don't want to look down at your toes. That's the improper position. It's putting too much strain on the neck. A lot of people will make the mistake of reaching behind their head and pulling up on their head. We absolutely don't want that. There's also a way to cheat. If you want, you can put your fist in front of your neck, and that will prevent you from bending your neck and watching your abdominal muscles or watching your feet. We want your head in a neutral position. This is the safest, the best form, and you should get a great abdominal workout from this. The next exercise to help strengthen the lower abdominal muscles and the pelvis is the pelvic lift. And Alyssa will bring her buttock off the floor. You want to make sure that your shoulder blades are still touching the floor, but you don't want to put too much pressure at the base of the neck. But you want to hold it for at least a 10 count and then come back down. And you want to do 10 of these. You should squeeze the buttocks together, and you'll feel a real nice tight feeling into the buttocks. It's a great exercise for those of us who want to work out the buttocks and the glutes, and also it's beneficial for your spine and pelvis. The super people stretch, or superwoman stretch in this case, is one of my favorite exercises for the entire spine. It not only works the neck, the mid-back, and the low back, but it also works the buttocks and the legs, and even into the shoulders. It's really a great stretch or exercise to strengthen the entire spine. You want to lift the right arm and the left leg. You want to keep both your knee and your elbow straight. And you want to hold that. And we get a diagonal working across the back, and it's a great exercise. You want to hold this for 10 to 20 seconds at a time. Don't be discouraged if you can only hold this position for 5 to 10 seconds. At first, it can put a lot of strain on the back. If you ever get pain in the low back, you need to stop that immediately, and there's an alternative exercise that we will show you for that case. You want to do easily 10 of these and hold again for 10 to 20 seconds. This exercise is an excellent exercise because you're supported, you don't have a chance of falling. It isolates these muscles in a fantastic way. Now we're going to do all 4 extremities with both legs and both arms, keeping the elbow straight, Alyssa, and keeping the knees straight. You should feel a tightening in the buttocks, in the low back, and even up into the neck. You want to keep your head up, and that will also work the muscles in the mid-back and in the neck. An excellent exercise, but it does isolate the low back, and it can, for the patients who are not ready or not fully stabilized in your chiropractic care, you may get too much pulling in the lumbar spine. If that's the case, stop it, and we'll get back to it as you get better stabilized in your lumbar spine. The rules for stretching make sense. First, warm up. Go for a brisk walk or march in place. You want to increase your muscle temperature so that you get a mild sweat going. That's when you get the benefit of the maximum stretch. Second, a gentle stretch. Never bounce. You should feel pull, but no pain. You should feel good when you stretch. If you get pain, stop immediately and tell me. Third, hold for 15 seconds initially on most of the stretches, then progress an additional 1 to 2 degrees gently and hold for another 15 seconds to get your maximum benefit. 4, breathe deeply with the abdominal breathing and relax. 5, stretch both sides for balance and symmetry. 6, avoid all stretching or exercise if experiencing acute severe pain. Early exercise and stretching could make it worse. If in doubt, call us. Walking is usually okay in most instances. 7, be sure that the individual case does not limit you in these exercises and stretches. Past spinal surgeries, spondylolisthesis, or malformation can limit your participation in these exercises and stretches. 8, if you feel dizzy, lightheaded, or have pain during any of the following of these exercises or stretches, tell us immediately and stop immediately. Number 9, doing these consistently will keep you healthier, keep you active, and maximize your experience in our office. Try it for 21 days and see and feel the results. They will carry you through the rest of your lifetime. In conclusion, every process takes time. Healing takes time, putting braces on your teeth takes time, and if you're patient and do the things that we ask you to do with the stretches and exercises, I ask you to do them for 2 to 3 weeks, and if the benefits alone don't motivate you to continue, then stop them. But we also need you to watch your ergonomics on a daily basis and watch those pitfalls that can get in the way of your healing at the fastest rate possible.